The recent uptick in violence is part of a trend. There's a great deal of disparity between a livable wage in Hawaii for families of 4 and others and income of our residents. And it's creating a tension. We're seeking to find solutions. We believe the best solutions come from the community. We're asking that government leaders listen to what we consider a public health emergency. They help us to provide the resources. We'll do our part. We need to do better, and maybe they need to do better.
Aloha, everyone, and mahalo for taking the time to be with us out here today. You know, it was once written that the most prized warriors of Oahu normally came from the Waianae and Ewa regions. And it was said that because of our arid, rugged terrain, it produced people who knew how to handle hardship. Historically, our people and this ahupua'a were known for its strength and resilience. But when our community is repeatedly expected to be resilient without sufficient resources to recover, it takes a significant toll. Our community is experiencing an emotional, mental, and physical exhaustion that for some has led to a sense of hopelessness. Without adequate support, trust in the institutions and systems designed to help begins to erode. And this results in frustration and a breakdown of community. Long-term exposure to adversity without recovery can lead to intergenerational trauma, where stress, instability, and hardship are passed down, making it harder for our future generations to thrive. Resilience without proper support eventually becomes unsustainable, and communities reach a point where recovery is extremely difficult. And without substantial intervention and support, may be impossible. This is very personal for me. I was born and raised on this coast. And what has unfolded in our community has broken my heart. I have dedicated my adult life to trying to make this community a better place. For me, for my family, for my neighbors, for my friends, and future generations to come. And I have to admit, I am at a loss at making sense of all of this. I am tired of being resilient, but I know that we must. So please help support our coast and the resources that we need in place to be able to care for our community.
In this moment of this public health emergency, it's important to realize the roots of the discord, why this is happening. And much of it really points to a chronic lack of public health infrastructure, and that in turn promotes a lack of hope for a better future and a lack of trust that the status quo can make things better. We've tried to fill the gap as a community health center, but we need more concerted and collaborative effort from city and state entities to be able to do that. We are born of the community. We are controlled. Our board of directors are community members. So we are integrated 100%. We have a 24/7, 365-day emergency room, for example, that really tries to be there for all those incredibly difficult moments, such as we've passed right now. Right now, our emergency room is grossly underfunded and has been for years. We're running at a deficit. This has to be taken into account. Our emergency services are vital in this area, and we intend to maintain these services and to be there for all the community, all the folks here in this community that we really love. So we are poised to act in any possible way, but that has to be in concert with the community, with the desires of the community, with the assistance of the entities that help us do what we need to do. Mahalo.
On September 12th, Waianae Comp submitted formal letters to both the governor and the mayor addressing the gun and public health crisis and the resulting trauma on the Waianae coast. Waianae Comp has provided a roadmap for public health response that I'll cover further in my remarks. First, a public health crisis is a situation that poses significant threat to the health and well-being of a population, caused either by natural or man-made events, and has significant impact on community health, the economy, and/or loss of life. The sustained increase in violence, including a devastating increase in gun violence, including a mass casualty and mass fatality event, is a public health crisis here on the Waianae Coast. Given that it's an immediate crisis level solutions are needed to address the overall community health concerns, including potential trauma related to increased anxiety, a sense of feeling less safe, and the stress of increased negative stereotypes being perpetuated through media and social platforms, also including community, youth, and athletic events being canceled, further exacerbating the trauma. Waianae Comp strongly believes, given the public health crisis is immediate, coordinated government action and support is necessary to address the full scope of the crisis, including healthcare, community, and public safety impacts. As it relates to healthcare, including public health response, Waianae Comp has created a roadmap, a proposed public health response for the community. These points were included in the letters to the mayor and the governor, and I'll cover a few of those points, or the points. One, very important, trauma resilience counseling training. Waianae Comp, through the leadership of our board of directors and our leadership team, has launched an immediate community-wide trauma and resilience program aimed at helping individuals cope with deep emotional and mental tolls caused by the escalating violence. This includes workshops designated to educate and equip participants with tools for resilience, one-on-one counseling sessions, and group support sessions that allow individuals to share and heal in a supportive community setting. We have requested formally $500,000 from the city and state collectively to launch this initiative and ensure ongoing counseling and mental health services. Irrespective if we get the funding, we will find the operational dollars within our budget to launch this service, but we do think that it's important that city and state, given this a crisis, work with us for that immediate potential trauma and to help us build resilience. Secondly, we will continue to work to ask the state to help us expand mental health services to focus on trauma recovery programs. It's important that we have services, but we need to further expand them, especially since we know there's a crisis and a trend that's disturbing. So we need to increase access to trauma-informed care, provide culturally sensitive treatment, and focus on destigmatizing mental health care. Those are all initiatives that we do now, but we think, again, given the crisis, the state and city should help us expand those services. And also a very near-term ask that we've asked is the state of Hawaii's MedQuest division has allowed an exception for federally qualified health center behavioral health providers to provide care remotely and to not have to exclusively be on site to provide telehealth services to patients. This exemption is due to expire on December 31st of this year. In light of the current crisis, Waianae Comp is formally requesting that the state issue another extension to this exemption. This will allow providers to deliver care through telehealth and remote service options, ensuring that there's no gaps. The fact that the potential to reduce services in the midst of this crisis, in a way, is really incomprehensible. And it also speaks to the sort of systematic inequities that are built into the system that at a time of crisis there may be further reducing the ability to provide services. So again, we ask the state to immediately, extend that exemption. Fourth, safety and security enhancements for the Waianae Coast Comprehensive Campus. We've increased our security personnel, infrastructure improvements, and we're really working to strengthen our relationship with the Honolulu Police Department to improve coordination during time of crisis. We must ensure that our facilities remain safe for all who seek care. So we will absolutely be entering into a grant and aid to the state to help us fund additional security initiatives. And we also will be reaching out to the city. Support for our emergency department. As a part of the city and state's emergency management systems, especially if you see the geographic isolation, one road in, one road out, also how far it is to another health facility, we are a vital part to the city and to the state's emergency management system. And we are seeking state and city support to maintain our vital services. Since 2008, Waianae Comp has received a state subsidy of $1.4 million annually to help our operating hours between midnight and 8 a.m. We have not received an increase in that subsidy in 15 years. 15 years. While at the same time, we've seen increases to support other critical access hospitals throughout the state. We must address this issue with the city, but especially with the state, to ensure that our vital services are maintained. Like Dr. Bradley said, that the money that we lose on emergency, we have to find other operational dollars to support that vital service, and those could be reimbursed for other services. And to have a facility that vital not receive an increase in their subsidy for 15 years truly speaks to systemic inequities. So, in closing, I'll say this. This is the time and opportunity for government to concretely address health equity concerns for the Waianae Coast, while at the same time also addressing those inequities for Native Hawaiians and Pacific Islanders that make up the majority of the patients that Waianae Comp serves. We're asking to partner on immediate crisis response and also long-term support to ensure expansion and viability for critical healthcare services. 60% of the patients that we serve, Waianae Comp serves, identify as Native Hawaiian and/or Pacific Islanders, with 71% of our patients with an income of 100% below the poverty level. This is the time for government, city and state, to continue to deliver on the promises of addressing health equity. Now is the time to show the true aloha spirit in action. Thank you.
We understand that the increase in violence in our community has affected everyone, one way or another. We want to reiterate our expansive services here at Waianae Coast Comprehensive. We provide medical, social, and behavioral health services. If you need behavioral health support, we have BH clinicians ready to serve. If you know of someone who needs behavioral health services, please reach out to us. There's no shame in seeking behavioral health care, and there's no wrong way and no wrong approach in seeking services. Please do not allow the stigma of mental illness prevent you from seeking services. We are here for you. Access to medical care, especially behavioral health care, is very important to us. We are here, we stand with our community through this crisis, and we support our community. Please reach out to us. As Dr. Bradley mentioned earlier, we have behavioral health services integrated into almost all our primary care settings. We have behavioral health services throughout the main campus here in Waianae. We also have behavioral health services available in our Nanakuli Clinic, Kapolei, Eva, and our Waipahu Clinic. We are here to serve you. I also want to mention that in our school-based facilities, we have BH clinicians that are available to see our students in the intermediate and our high school along the Waianae Coast. Again, I would like to say we are here for you. We are here for our community. We are your community health center. So please reach out to us. If you're having problems with depression, anxiety, problems sleeping, anger, or trauma from the recent events, please reach out to us. We are here and we are available. We can be reached at 808-697-3469. Again, like I said, we are your community health center and we are here to serve you. We will do our best to provide you with the services that you need, but more importantly, the services that you deserve. Mahalo.